Welcome to the Deep Dive. Today we're tackling something found in many homes that, well, can be surprisingly dangerous, especially for dogs. We're talking about iron.
That's right.
We'll be digging into some expert veterinary insights, specifically from veterinary iron toxicosis management. We want to really understand the risks, what signs to look out for, and just what makes too much iron so harmful.
Absolutely.
So our mission today really is to give you the knowledge to hopefully prevent a bad situation with your own pets.
Exactly. Because iron is essential, obviously vital for life. But that line between helpful and harmful, it's narrower than you might think. We need to understand how it can turn into this hidden danger.
Okay, let's unpack that. Iron carries oxygen, fundamental stuff. How does something so necessary suddenly become, you use the word corrosive, and damaging?
Well, think of it like this. Normally, iron absorption is really tightly controlled by the body.
Okay.
But when a large amount gets ingested all at once, say a dog eats a whole bottle of supplements, the body's normal processing, its transport system, it just gets completely overwhelmed. It's like a tiny country road suddenly hit with motorway traffic.
All right, gridlock.
Total gridlock. And that excess iron, the stuff that can't be handled properly, it can directly irritate and, even corrode the lining of the stomach and intestines.
Corrosive. That really paints a picture. So what kind of everyday things are we talking about here? Where do we find these high concentrations of iron that's easily absorbed? I'm guessing it's not just like rusty nails.
No, you're right. Often it's much more common stuff. We're talking about multivitamins, and pay attention here.
Yeah.
Adult multivitamins often have way more iron than kids' versions.
Okay.
Then you've got individual iron supplements, prenatal vitamins, obviously high in iron, but also some things you might not expect.
Like what?
Certain slug and snail baits can contain iron phosphate. Some types of disposable hand warmers have iron powder.
Hand warmers, really?
Yep. And some iron-fortified fertilizers, and even those little oxygen absorber packets you find in jerky or other packaged foods.
Wow, those little silica gel-like packets.
Yeah.
Not silica gel, but similar looking.
Exactly. The oxygen absorbers often contain elemental iron, and the form of iron in many of these products is readily absorbable, which is key.
Okay, that's quite alarming, actually. Those little packets seem so harmless. You mentioned the body's absorption gets overwhelmed. Can we go a bit deeper? What's happening on, like, a cellular level?
Sure. So the body has a specific capacity to bind and transport iron safely in the blood. Think of it like having special taxis proteins just for iron. The total number of seats available in all those taxis, that's what vets call the total iron binding capacity, or TIBC.
TIBC, got it.
Normally, ingested iron gets absorbed, hops into a taxi seat, and travels safely where it needs to go. But in a big overdose, all the seats get filled up fast.
Right. No vacancies.
Exactly. And you've got all this extra iron left over, sort of floating free in the bloodstream without a chaperone. This free, unbound iron is highly reactive. It starts causing oxidative damage to cells.
Oxidative damage, like rust, but inside the body.
Sort of, yeah. It particularly damages the mitochondria, which are like the tiny power plants inside each cell. Messing with them disrupts the cell's energy production. That's a major reason iron overdose gets so dangerous systemically.
So the unbound iron just runs wild, causing chaos. Which parts of the body tend to bear the brunt of this?
Well, the first hit is usually the gastrointestinal system because of that direct corrosive effect we talked about.
Makes sense.
Then, as the iron gets absorbed into the bloodstream, the liver has to work overtime trying to process it all, so the liver is very vulnerable to damage.
Okay, GI tract, liver. Anywhere else?
Yeah, we can also see effects on the cardiovascular system, sometimes leading to shock. And even the nervous system can be affected, maybe causing tremors or other neurological signs.
Okay, quite a widespread impact then. GI, liver, cardiovascular, nervous system. So we know how it's dangerous. Who is most likely to run into this problem?
By far the most common patients we see with iron toxicosis are dogs.
Figured as much.
Yeah, their, let's say, indiscriminate eating habits and natural curiosity just make them prime candidates. If something with iron is left out, pills dropped on the floor, an open container, they're quite likely to, well, sample it.
Definitely. My dog would eat anything.
And it's important to remember, this isn't just a puppy problem. Dogs of all ages are potentially at risk if they get into these things.
Good point. Now, the source material describes this unfolding crisis in 4 stages. That sounds pretty dramatic. Can you walk us through that timeline? What happens after a dog eats too much iron?
It is quite dramatic, and it progresses. Stage A usually happens within the first 0 to 6 hours after ingestion.
Okay, pretty quick.
Yeah. And the signs are mostly gastrointestinal. Vomiting, sometimes with blood, diarrhea, also potentially bloody, lethargy, seeming depressed, and signs of abdominal pain, maybe whining or not wanting to be touched there.
Okay, that sounds like clear warning signs. You'd notice that.
You would hope so, yes. But then comes stage 2, and this is absolutely critical for owners to understand. It occurs roughly between 6 and 24 hours post-ingestion.
And what happens then?
This is often called the apparent recovery phase, or a latent period. The dog might actually seem to get better.
Better?
Yeah, the vomiting and diarrhea might subside. They might seem a bit perkier. But, and this is the crucial bit, this is often deeply misleading.
How so?
Because even though the outward signs might improve, internally, the absorbed iron is still causing significant damage, particularly to the liver and other organs. Assuming the danger has passed just because the dog seems better is a huge mistake.
Wow. That's really scary, a false sense of security. So what happens after this deceptive lull?
Well, that leads us into stage 3, which typically kicks in somewhere between 12 and 96 hours, so half a day to maybe full days later.
And the symptoms return?
Often, yes, and frequently much worse than in stage 1. We can see a return of severe vomiting and diarrhea, profound depression or lethargy, ongoing GI bleeding, and then potentially signs of shock, tremors, worsening abdominal pain, and a condition called metabolic acidosis.
Metabolic acidosis sounds bad.
It is. It means the body's chemistry is severely out of balance, becoming too acidic, which affects all sorts of organ functions. It's a life-threatening complication.
Okay, so stage 3 is a major crisis point. What about the final stage, stage 4?
Stage 4 is a longer-term consequence. It can occur maybe 2 to 6 weeks after the initial poisoning event.
Weeks later.
Yeah. This involves the potential formation of scar tissue, or what we call strictures, in the GI tract, usually the stomach outlet or intestines.
Strictures, like a narrowing.
Exactly. This scarring narrows the passage, which can cause chronic problems like vomiting, difficulty eating, weight loss, and might even need surgery down the line to correct.
So the danger isn't just immediate, it can have lasting effects weeks later. Okay, let's circle back to the toxicity itself. What actually makes a dose dangerous? We know the source matters, but what about the quantity? Is there a threshold vets look for in dogs?
There is a general guideline. A dose greater than 20 milligrams of elemental or absorbable iron per kilogram of the dog's body weight is usually considered potentially toxic.
20 milligrams per kilogram, okay.
But, and this is really important for you listening, you can't just look at the milligrams listed on a supplement bottle.
Why not?
Because different iron compounds, different salts, contain different percentages of actual elemental iron. For instance, ferrous sulfate, a very common type, is about 20% elemental iron by weight.
Okay.
But ferrous fumarate is closer to 33%. Ferrous gluconate is only about 12%. So 100 milligrams of ferrous gluconate gives you much less elemental iron than 100 milligrams of ferrous fumarate.
Ah, I see. So the same pill weight could mean very different iron doses. That makes trying to calculate it yourself pretty tricky.
Extremely tricky and potentially dangerous to get wrong. It really requires knowing the specific type of iron salt involved.
So the bottom line is, if you suspect ingestion, don't try to do the math yourself.
Exactly. Contact your vet or an animal poison control center immediately. They can help figure out the potential risk based on the product, the amount possibly ingested, and your dog's weight. Also, just to clarify, things like metallic iron say if a dog swallows a coin or a nail or iron oxide, which is rust, these aren't easily absorbed or ionized by the body.
Right.
So they aren't typically associated with this kind of acute toxicosis we're discussing. It's the soluble iron salts in supplements, baits, and those other things we listed that are the main concern.
That's a very important distinction. Okay, so let's say a dog owner calls the vet, suspects iron poisoning. How does the vet actually diagnose it? Confirm that's what's happening?
Well, often the history is key. Did the owner see the dog eat pills? Is there a chewed up bottle? That's obviously a huge clue.
Sure.
And as we talked about with the stages, that initial 6 to 8 hour window is interesting. If a dog ingested something potentially toxic several hours ago but still has absolutely no symptoms, it might be less likely they absorbed a dangerous amount, but you can't rely on that.
Right, because of that latent phase.
Precisely. We also have to consider other things that can cause similar symptoms, what we call differential diagnoses.
No kind of things mimic iron poisoning.
Oh, quite a few. Severe gastroenteritis from something else entirely, like a virus or bacteria, or even just eating garbage. Gastric torsion or bloat can cause shock and pain. Snake bites, swallowing other corrosive things like cleaning agents, even heat stroke can present with some overlapping signs.
So you need tests to sort it out. What do blood tests show in iron poisoning cases?
We often look for specific changes. An elevated white blood cell count is common. Blood sugar might be high, which is hyperglycemia. Liver enzymes, things like AST, ALT, ALP, might be normal initially, but can increase later as liver damage occurs. We look for that metabolic acidosis we mentioned, a sign the body chemistry is off.
And what about measuring the iron itself? You mentioned serum iron and TIBC earlier.
Yes, those are really crucial diagnostic markers. We measure the total amount of iron circulating in the serum. If that level is very high, generally the threshold vets worry about is above 350 to 500 micrograms per deciliter. That's a strong indicator. Or, even more definitively, if the measured serum iron level is actually higher than the calculated total iron binding capacity, TIBC.
Meaning there's more iron than the taxis can carry.
Exactly. If serum iron is greater than TIBC, that confirms there's dangerous free iron circulating, and treatment, especially chelation, is definitely needed.
And you need to test this quickly.
Yes, and potentially repeatedly. Iron levels in the blood can peak quite rapidly, maybe within 2 to 6 hours after ingestion. So we often recommend checking levels at maybe 2-3 hours and again at 5-6 hours post-ingestion, even if the dog seems fine initially.
Because things can change fast.
Very fast. And we also need a good quality blood sample. It shouldn't be hemolyzed, meaning the red blood cells burst, as that can falsely elevate the readings.
Okay, so careful blood draws and timely testing are key. Can imaging, like x-rays, play a role?
Sometimes, yes. Iron pills are often quite dense and opaque, so they can sometimes show up clearly on an X-ray, especially if they're still intact in the stomach or intestines.
You might actually see the pills.
You might, or sometimes you see a big clump of partially dissolved pills stuck together. We call that a bizor. Seeing that on an X-ray confirms a large ingestion.
Right. Any other diagnostic tools?
Well, doing tests after an animal has passed away, a post-mortem, often isn't that helpful for confirming iron specifically as it distributes around the body. Analyzing stomach contents, if the animal vomits or if we do lavage, can sometimes help quantify the exposure. Pathologists might look for specific tissue damage, like bleeding in the GI tract or liver damage, under the microscope if biopsies are taken or a necropsy is performed.
Okay, so it's really a combination of history, clinical signs, blood tests, especially those serum iron and TIBC levels, and sometimes imaging. Once the diagnosis is made or strongly suspected, what's the treatment plan? How do you counteract this?
Treatment has a few main goals. First and foremost is immediate supportive care.
Stabilize the patient.
Exactly. If the dog is dehydrated or in shock from vomiting, diarrhea, or blood loss, we need to give intravenous fluids aggressively to restore hydration and blood pressure. If that metabolic acidosis is severe, we might need to give intravenous sodium bicarbonate carefully to help correct the body's pH balance.
Okay, stabilize first. Then what about getting rid of the iron itself?
Right. The next goal is decontamination, removing any iron that hasn't yet been absorbed from the gut.
How do you do that?
If the dog is seen very early, hasn't started vomiting yet, and is stable, we have a few options. We might give something orally, like milk of magnesia or aluminum hydroxide. These can bind iron in the stomach and make it less absorbable.
Okay.
Inducing vomiting or emesis is another key step if the ingestion was recent and the dog is asymptomatic. We use specific drugs like 3% hydrogen peroxide carefully dosed, or a drug called epimorphine.
But only if they aren't showing signs yet.
Generally, yes, and there are risks, so it needs veterinary supervision. If inducing vomiting isn't safe or effective, or if x-rays show a lot of pills still in the stomach, especially a bizarre, we might perform gastric lavage.
Which is?
Stomach pumping, essentially. We pass a tube into the stomach and flush it out repeatedly with fluid to remove the contents.
Sounds intensive.
It can be. And in really rare cases, if there's a huge mass of pills that can't be removed by lavage, emergency surgery, a gastrotomy, to physically open the stomach and remove them might be the only option.
Wow. Okay, so that handles the unabsorbed iron. What about the iron that's already in the bloodstream causing problems?
That's where chelation therapy comes in. Chelate basically means to grab onto.
Okay.
We use a specific drug that binds strongly to the iron circulating in the blood, forming a compound that the body can then excrete, usually through the kidneys and the urine.
And you use this when the blood levels are high?
Yes, it's indicated when those serum iron levels are above that 350-500 Agord-DL threshold, or definitely if the serum iron is higher than the TIBC.
What's a drug used?
The chelator of choice for iron poisoning is called deferoxamine mesylate. There's another chelator, calcium disodium EDTA, but it's generally considered less effective for iron.
Deferoxamine. And how long does that treatment last?
It's typically given as a continuous intravenous infusion, and we continue it until the clinical signs resolve A and D. Those serum iron levels consistently drop below about 300 GDL, or until the TIBC is clearly higher than the serum iron again. It can take hours, sometimes a day or more.
So it's a monitored process. Are there other medications you use alongside fluids and chelation?
Oh, yes. Since vomiting is such a common problem, we use antiemetics, anti-vomiting drugs like meropitant or ondansetron to make the animal more comfortable and prevent further fluid loss.
Makes sense.
We also often use medications called GI protectants like sucralfate, which coats the irritated stomach lining, and sometimes antacids. Plus, drugs to reduce stomach acid production H2 antagonists like Fimocho or proton pump inhibitors like omeprazole can help the damaged gut lining heal.
Lots of supportive meds then. Are there any treatments that are definite no-nos or things to be cautious about during treatment?
A key thing to remember is that activated charcoal, which is a go-to for many other types of poisonings because it binds toxins in the gut.
Right.
It does not bind iron effectively at all. So giving activated charcoal is pointless for iron toxicosis.
Good to know. Any other cautions?
Well, we have to be careful with gastric lavage if the dog is already vomiting blood or if we suspect the stomach might be perforated, as the procedure could make things worse.
Yeah.
And the deferoxamine chelation therapy itself needs care. It has to be given as a slow, constant rate infusion intravenously. If given too quickly, it can potentially cause low blood pressure or even heart rhythm problems.
So careful administration is vital.
Absolutely. And one other point about deferoxamine, it has shown potential to cause birth defects in lab animals. It's teratogenic. So if the poisoned animal happens to be pregnant, we have to carefully weigh the risks versus the benefits of using it.
Right. A difficult consideration. Okay, so after the immediate crisis is managed, the fluids, decontamination, chelation, what about follow-up? Are they out of the woods then?
Not entirely. We usually want to monitor liver enzyme levels in the blood for a period afterwards, maybe several days or even weeks, just to make sure there's no delayed or ongoing liver damage.
Checking for that liver hit.
Exactly. And we also need owners to keep a close eye out for several weeks for any signs of potential GI obstruction, like recurrent vomiting or difficulty eating because of that risk of stage 4 stricture formation we discussed earlier.
Right, that delayed complication. Okay, this has been incredibly informative and honestly quite sobering. It really highlights how something so common can pose such a serious risk. Let's try and summarize the key points for everyone listening.
Absolutely.
Yeah.
I think the main takeaways are iron is essential, but an overdose, even from seemingly small things like supplements or hand warmers, can be incredibly dangerous, even fatal, particularly for dogs.
And those household sources are everywhere.
They really are. Be aware of that deceptive apparent recovery phase. Just because your dog seems better after initial sickness doesn't mean the danger is over.
Crucial point.
Prompt veterinary attention is absolutely vital if you suspect any significant iron ingestion. Don't wait and see. And maybe the most important point of all, prevention. Keep all iron-containing products, vitamins, supplements, baits, warmers securely stored well out of reach of pets.
Definitely. Prevention is far, far better than cure here. Which leads perfectly into a final thought for you, our listeners. Take a moment after this, maybe walk around your house and really look with fresh eyes. What things in your cupboards, on your shelves, or even in your garage contain iron? Those vitamins, that garden product, those little packets. What simple, easy steps can you take today to make absolutely sure that everyone in your household, furry or not, is safe from this hidden danger of accidental iron poisoning?
It's a really worthwhile exercise.
It really is. Thinking about that could truly make all the difference. Thanks so much for joining us for this deep dive today.
My pleasure.